All right, let's dive into one of the biggest revolutions in cancer treatment, immunotherapy. I mean, it is a total game changer. But, like any powerful new tool, it comes with its own set of challenges. So today, we're going to break down this critical new fight that doctors are waging, how to manage its very unique side effects.
In this quote right here, it just gets straight to the heart of it. What used to be the treatment you tried when everything else failed, well, now it's becoming the go-to, the first-line weapon in the fight against a lot of cancers. And you can imagine that shift changes absolutely everything.
And we're not talking about a small shift. This is a massive one. As immunotherapy moves right to the front of the line, it means more patients are getting it, and they're getting it much earlier. So understanding its full impact, both the amazing benefits and the real challenges, has never been more important for everyone involved.
So how does this stuff actually work? Well, at its core, the idea is just brilliantly simple. Instead of using chemicals to directly poison and kill cancer cells, immunotherapy just unleashes the power of your own body's defense system. It basically teaches your immune system to recognize and attack the cancer. It's a whole new strategy.
But, and this is the central conflict of our story, when you supercharge the immune system, you create this incredibly powerful force. And yeah, it's fantastic at hunting down and killing cancer, but that very same force can sometimes turn against the body itself. It really is a double-edged sword.
So these unique side effects, they have an official name: immune-related adverse events, or what you'll hear called IRAs. The key phrase to lock onto here is autoimmune-like. This is your body's supercharged defense system getting a little too excited and causing inflammation in perfectly healthy organs, and it can happen almost anywhere.
You know, a good way to think about it is like your immune system is a car. Immunotherapy basically cuts the brake lines, letting it go full throttle right at the cancer. But without those brakes, sometimes it can swerve off the road and cause some collateral damage. That's what we call friendly fire.
Now, I know this might sound a little scary, but here's the really good news. The medical world has not been caught off guard by this. There's a very clear, very systematic plan, a playbook you could call it, for managing these side effects safely and effectively.
This is not guesswork. The whole approach is standardized, and it's based on guidelines from major cancer organizations. And the most crucial tool they use is something called a grading system. Every single side effect gets rated for how severe it is, and that grade dictates the entire treatment plan from start to finish.
And here's how that grading system plays out. For a mild grade 1 reaction, docs might just keep an eye on it. But if things climb to grade 2, they'll actually pause the immunotherapy and bring in some steroids. And by the time you're at grades 3 and 4, which are severe or even life-threatening, we're talking about stopping the therapy altogether and using high-dose IV steroids. It's a clear escalating response.
Okay, so the theory is great, right? But what does this actually look like in the real world? Let's take a look at a couple of specific side effects to see how this management playbook is actually put into practice.
Let's start with the ones you see most often. The first place these side effects tend to show up is right on the skin. This is what doctors and pharmacists are on the lookout for most frequently.
So this could be anything from a rash to some pretty intense itching, or even something called vitiligo, which is where you lose pigment in your skin. And the management, it follows that grading system perfectly. Mild cases might just need a topical cream. More serious ones, you're pausing the therapy and using systemic steroids to calm that inflammation right down.
But get this, here's a fascinating little twist. For patients with melanoma, that skin side effect, vitiligo, it's often seen as a good thing. It suggests the immune system is so fired up that it's attacking both the cancerous melanoma cells and the normal pigment cells. It's actually a powerful sign that the treatment is really working. How about that?
Okay, so let's shift gears now to the other end of the spectrum. A much less common but way more dangerous side effect: inflammation of the lungs, which is known as pneumonitis. This is where the stakes get really, really high.
The symptoms are pretty much what you'd expect, a new cough, shortness of breath, but the response for a severe case is drastic. We're not just talking about a pause, it's a permanent stop to the immunotherapy paired with aggressive IV steroids. This particular side effect is just too serious to risk it ever coming back.
And this brings us to another really critical point. Most of these side effects, like a skin rash, are reversible. You use steroids, you calm the immune system down, and once it's all resolved, the patient can often go right back on treatment. But some damage, especially to the endocrine system, like your thyroid or pancreas, is permanent. Steroids can't fix it, and in those cases, patients might need lifelong hormone replacement therapy. It's a huge difference that can affect a person's life long after the cancer's gone.
Okay, so let's pull all this together. We've got this revolutionary treatment. It's now a first-line therapy, but it demands this whole new level of watchfulness and management. So what's the big picture here? What does this all mean?
Well, if you remember anything, remember this. Immunotherapy is an incredibly powerful first-line treatment, and it is here to stay. But its success totally depends on managing these unique autoimmune-like side effects. The good news is, a clear, grade-based system exists to do exactly that, and it all boils down to one thing: careful monitoring and really swift, decisive action.
And that leaves us with one final thought. Right now, we've gotten very good at reacting to these side effects. But the next frontier, that's prediction. As our understanding of the immune system gets even more sophisticated, will we one day be able to figure out which patients are at risk? And maybe, just maybe, stop these side effects before they ever start? Now that's the future we're all hoping for.